Good afternoon, and thank you for joining us. My name is Jose Leon. I am the Chief Medical Officer for the National Center for Health in Public Housing. Thank you so much for attending our third session. It's been a while since we had our second 2 weeks, so we have very good information for all of you. It's before we get started, we have had some issues with Moodle. So if you have been trying to access Moodle and access some of the materials, we've been having some technical difficulties that we are working on it. So hopefully you will be able to access all the materials and welcome packet and the handouts in the next few days. This is a live session, so at this moment our lines are muted. If you have any questions, please save your questions or to the end. We are going to have a Q&A session, and you will be able to ask questions to our panelists. So save your questions. Again, we are the National Center for Health in Public Housing. We provide training and technical assistance to community health centers, specifically or especially to those located in or immediately accessible to public housing. Our national center is funded by HRSA to provide these activities. The latest data that we have from HRSA shows that there are 108 public housing primary care grantees. Those are health centers receiving funds from HRSA to provide health services and prevention services to those living in or immediately accessible to public housing. And in 2019, they served over 800,000 patients, specifically addressing not only chronic medical conditions, but the social determinants of health affecting the population that they serve. This slide shows some demographics about those living in public housing. Is always good to highlight some of the statistics here in regards to the number of, or the percentage of those who are over the age of 65 and those who have one or more disabilities, and the percentage of those with low income. In 2018, the Centers for Disease Control and the Administration of Urban Housing and Urban Development work together to put some numbers regarding the health status of those living in public housing. And in addition to diabetes, which is one of the HRSA priorities that all health centers are working on, I would like to just highlight as well the percentage of patients with COPD and asthma, which are two conditions that are either affecting those who are smokers, or in the case of asthma, the disease is exacerbated for if you are a smoker. So this is a great opportunity to discuss smoking cessation strategies at the health center level. Again, all the materials, welcome packet, you can access it on Moodle. We are working on it. So if you have any needs or you would like to access the information and you can't and you need any of these materials, make sure that you can, to contact us, you can either contact Fide Sandoval, email address fide.sandoval@NAMGT, or you can also send me an email, jose.leon@NAMGT. So without further ado, I will turn it over to our subject matter expert. Good afternoon.
Good afternoon. Thank you, Dr. Leon. All right, so we're going to do the same thing that we did last time. Oops. Okay, can you see this?
We can.
Okay, good. All right, so this is the protocol that we, excuse me, that I sent to you a few weeks ago. So we went over the first two sessions last time. We'll do the middle two sessions today, and then our last session at the beginning of December, we'll go over the final two sessions. But before I do that, I'd like to just take a minute. Can you all give me some feedback? I'd like to know, were you able to get your patient or patients and start your counseling, and what that's been like for you? How has that been going? If you haven't been able to get anybody, that's we understand that there's lots of things going on, but I'm just curious how that's been going. So if you could all unmute yourselves and let me know that. We'll take a few minutes to discuss that right now. So one of you brave enough to start?
Anybody, Fide, using the raise hand icon? If you would like to have a conversation with Frank, make sure that to use the raise hand icon, and your line will be unmuted. Anybody, Fide?
Yep, I'm going to unmute right now the line for Tiffany.
Okay, great.
Hi, this is Tiffany in Ohio, and I have yet to have any clients, but I'm certainly going to be well prepared after these seminars. They are a wealth of wonderful information, so thank you so much.
Good, good. What is the issue about getting clients, if you don't mind me asking?
My position here in this health center is new, and so they are kind of waiting to establish the flow from the practitioners to me.
Okay.
So I'm in that preparation stage now.
Gotcha. Do you have a friend or a relative that smokes that you might be able to quote unquote practice on?
Oh, I could probably find one, yes.
I mean, that might be, I'm not trying to be pushy, but that might be a good thing to do just to get yourself comfortable with talking about this subject. That was the whole point of trying to spread this out over the, time. So think about that. That might be an alternative just to get prepared, get yourself prepared.
I will, thank you.
Okay. Thanks, Tiffany. Anybody else?
Not at the moment.
All right, so if you do feel like sharing, please just raise your hand, and Fide will unmute you. And I would really like to know what's happening with all of you. In the meantime, I will go through these next steps. So as we said at the very beginning, the first session is the introductory materials, just to get the person used to what is going to be happening and how this is going to work. The second session focused on all the steps that the client is going to take to actually get ready to quit. And then today is the actual quit day. So I really strongly recommend that if you're doing this as a group, the third session definitely is the quit day, that people know this well ahead of time so that they aren't surprised or, and that they're ready for it. And then on the quit day, what you're going to focus on is how to help these individuals learn to cope with living their life without cigarettes. Now, if you're doing this individually and somebody needs a little more time before their actual quit day, that's fine. But I still would like you to make this topic the main topic of what you're discussing with the person on the quit day. So if they need to talk to you 2 or 3 or 4 times before they actually quit, that's fine, because then you can work through whatever issues are going on there and then launch into this. So I will go through the protocol, and I've also included what you have. It's called the coping menu. So we'll get to that in a minute or so. But as you begin every one of these sessions, no matter whether they're group or individual, the first thing you want to do is congratulate the person or the group for whatever they did between the last time you saw them and today. So you really want to keep this upbeat. You want to keep it positive. And if the person has not been able to quit, or they've had a relapse or a slip, or whatever's happened, and they're perceiving it as negative, and you really can't find anything that they actually did that was positive, the very fact that they came to see you today is positive. So that's what I want you to focus on. If there's nothing else, congratulate them for actually continuing in the process, for coming to see you, and for showing up today. Then what I'd like you to do is then give each person a few minutes to describe what they've gone through over the last week. And that's how you're going to start every one of these sessions from here on in. Is basically, excuse me, I got something in my eye. Is basically to ask them to tell you how the last week has been, what their wins are. And that's how I'd like you to put it. What are the positive things? What are their wins? And then what are their challenges? So don't consider anything as a failure, just challenges, because challenges imply that we can overcome them. So that's the whole point, is that we are going to work with them to help them overcome whatever these issues are. If somebody has not done their quitting ceremony, as we described last week, they can do it at the group, or they can do it in the room with you. That's perfectly fine. And again, we really want to have them do something that is meaningful to them to end this. And that's very important psychologically, that the person actually does something, says something to themselves that I'm done, it's over, it's been fun, but you're killing me, so I'm ready to move on. So whatever they are wanting to do as a quitting ceremony is fine. And again, they can do it with you or in the room with the group if you're doing the group. Okay, so you do want to review then, the whole focus of this is this concept of coping. So these are the basic cognitive and behavioral coping techniques. So you want to describe that in general, and then you want to get specific. So you want to look at this coping menu then, and the whole point of me giving you this is to help you start to learn different coping techniques that you'll eventually be able to tell people just off the top of your head. But for them and for the time being, this is actually going to give you lots of suggestions here. So we're looking at a lot of general stuff here. And by the way, if you want to copy this and give this to the person, you can. So we're looking at 2 types of coping techniques, cognitive and behavioral. So cognitive means changing how you think. Behavioral means changing what you do so that you're not having an urge or trigger for a cigarette. And you can do that beforehand to prevent an urge from happening. And you can also use coping techniques in the moment for those urges that do get through. So I'm not going to read through all this. You have this, you can read through it. I'm basically going to highlight a few things here as we go through this. As far as the cognitive techniques, most of them are trying to take your mind off of smoking or a cigarette. So they're distraction techniques. So you'll see that many of these are a variation of that. Behavioral techniques are pretty much changing the patterns and routines that trigger you to want a cigarette. If you really look at your life, we do many routine things every day in a very routine patterned way. So when we get up in the morning, when we go to work, when we have meals, many of those things are done pretty much the same way every day. And so it's that pattern that you associate with smoking, and that's what triggers you to want a cigarette. So if you change bits and pieces of that pattern, then that changes the whole of that. It becomes a new thing that is not connected to smoking. So I've given you some basic ideas here at the beginning of this, but then what I really want you to look at are these specific situations. So I've tried to give you at least 5 or 6 specific techniques that you can use in any given situation that most smokers are telling you trigger them to want a cigarette. So we can just run through these very quickly. I can give you just the highlights of each one of these areas. After meals, it's pretty much, as soon as you're done with the meal, getting up from the table and doing something else, because most people have that cigarette right after the meal. So there are many different things you can do. Those are some of them on the list here. Alcohol, as we know, many times people relapse because they have too much to drink. They're not thinking clearly. So we generally recommend that people not go out to bars, even though in almost every state in the country right now, most bars are smoke-free. There are still some exceptions to that. So some places do allow smoking inside. And even if they don't allow smoking inside, there's smoking outside. So it's too tempting. So at least for the first month or so, you want people to do something different or limit what they are drinking and where they're doing it. You have to have a drink habit at home where you know there's no cigarettes. Boredom is a big issue that we hear a lot about. So there are many ways to deal with that. However, again, and I emphasize this, and I said this the last time, all our smokers think that smoking is the only way to deal with all these situations. So what we're giving them here are alternatives. So many people will tell you, well, smoking's all, the only thing I can do to fill out time or to, when I'm waiting for the bus or, waiting in line for something. So really work with them to find different things to do. I always, recommend that people take some crossword puzzles with them or book or, anything like that can distract them. Breaks, again, strategize about what to do differently. They're in the car. It's interesting, if you talk to people when they are driving, they tend to have a cigarette at this stoplight, at that stop sign, at that corner, when they get to this point. So it's very patterned. So if they change their route, if they go a different route, believe it or not, that helps. Also, I really recommend that you start to listen to talk radio or get books on tape or audio books of some kind to keep your mind occupied. If you're just in the car and you have nothing to focus on, you're just going to start thinking about cigarettes. Coffee, again, that's changing patterns. The evening, hand to mouth. I added this recently because so many people, and if you're old enough, you think back to Nancy Reagan with drugs, and she's, the whole slogan was just say no. Well, the problem with that is most people don't know how to say no. So this is something that you can actually practice with the individual, is to help them understand that they can say no and to actually give them the words, whatever that is for them, to be able to do that. That will go a long way to help them deal with the situation when it does happen if somebody offers them a cigarette. We talked last time about living with another smoker, so I'm not going to go through that. Morning routine, again, is changing the order. So let's say you get up at 7 o'clock, you jump in the shower, you go downstairs, put on the coffee, you sit at the kitchen table with coffee in the same mug you've used for the last 10 years, and you have the radio on, and that's when you smoke your first cigarette. So the idea here, the concept, the theory is that that whole thing, the gestalt is the word used of that, is what is connected to smoking. So if you change bits and pieces of that, it becomes a new thing that is not connected to smoking. So for that person that I just described, I would recommend that they get up at 6:45, take a bath instead of a shower, have an automatic coffee maker, get a different kind of coffee, get a new mug, and go sit in the living room and put the TV on. So the idea here is that you don't have to stop living your life. Rather, you're changing how you do these things so that they don't trigger you to want a cigarette. So that whole new morning routine is a new thing that is not connected to smoking, but you're still having your coffee, you're still getting ready to go to work, etc. So this is not about telling people they have to go into a monastery or a convent for 2 or 3 months. Negative moods. So this is a really, really interesting part of this process, is that many people feel that smoking helps them manage these moods, these negative moods, or that smoking is a good way to get back at somebody if they make you mad. So I give you some things here to talk about with those individuals. Other smokers, again, that that kind of ties in a whole bunch of things that we talked about, parties and socializing. Again, a lot of specific things that you find in other sections, but I put them together here. Stress management, we'll talk about that in a few minutes. Telephone, this used to be a big deal with people when they had home phones, because they would always sit in the same spot and talk on the phone. Now I think with mobile phones, people still do it. So again, coming up with, ways to change how you do that will help. Now, for cognitive techniques, this I think is probably the most powerful one here. And that is the idea that you do not have to do what you think, everything you think. So if you have a thought about a cigarette, you don't have to smoke one. So remember that. Most smokers automatically think that if they have a thought about having a cigarette, that means they have to smoke it. But I always kind of joke with people, just because you think about something doesn't mean you have to do it, right? Because if all of us on this call did everything we ever thought about, every one of us would be either dead, in jail, or dead in jail. So the whole idea here, and this I think is probably the most powerful coping technique of them all, is to teach your clients just to say to themselves, okay, so what? I'm thinking about a cigarette. That doesn't mean anything. That doesn't mean they're still a smoker. All it means is that whatever situation they're in or whatever feeling they're experiencing is they used to connect that with smoking. So think about it this way, and I've used this analogy all through this about like breaking up with somebody. So say, especially the women on this call, say you had a boyfriend in high school and you had your song, and you broke up with that kid, after a year or so, you haven't seen him, heard him, thought about him, he's not been present to you for years, and say it's 25 years later, and you hear that song on the radio, and you start to think about him, what does that mean? Does that mean you want to get back together with him? Well, absolutely not. All it is a memory. So that's how you want to focus this for your clients. That once they quit smoking, it's just a memory, and then it's natural to have those thoughts. The worst thing you can do is to try to make yourself stop thinking about them. Because think about it. If you try to make yourself stop thinking about something, what happens? You think about it even more. So that's what all these cognitive techniques are about. And again, you can read through that. Dieting, we do not recommend that anybody go on a diet when they quit. And we talked about that during the training. So here are some things to, as well as the work situation. And that's that. So these are the top areas where people are expressing issues about where they are triggered to smoke. So it's kind of like a dictionary for you guys to refer to. So hopefully I've given you enough ideas, and that'll spark other ideas for the individual. So when you are talking to a patient, a client, or you're in a group, what you want to do first is say, okay, you're telling me that you really have strong urges for a cigarette after a meal. So what do you think you could do differently so that you don't have that urge? So ask them first what they think they can do. If they can't come up with anything, then you can go into the specific suggestions with them. And I usually offer 2 or 3 because you really don't know what their particular lifestyle is and what will work. And then you always want to do behavioral and cognitive. So you really want to, and you want these people to really use these things. So emphasize it with them that this is their homework. This is stuff they have to do in order for it to work. You know, you can tell them a million things, but if they're not willing to implement them, then they're not of much use. Now, the big question is, how long do you have to do these? Well, generally speaking, I say a month or 2, and that is enough time to kind of break all of those connections. But you may want to do them longer. And the interesting thing is, I found over the years that people, when they make this new pattern or routine, they like it. They get into something different, and that feels comfortable, and they just stick with it. So there's no hard and fast rule here, but I do want you to strongly encourage your clients to do this. All right, so you're going to hear this a couple of times, as we go along here. Anticipate, plan, and rehearse. So we really want to teach our clients to anticipate those situations that they think are going to be problematic before they happen. Create a plan to deal with it ahead of time, and then practice it. So let's pretend like you're talking to your client today, and this is their quit day, and they tell you, oh, I have to go to a wedding next week. And I'm going to have a lot of friends there who smoke. So rather than just send them into that without any kind of preparation or knowledge about what to do, use this anticipate, plan, rehearse. So we got a wedding. What's the plan? Okay, here's what I want you to do. I want you to make sure that you have a support person there, even if it's not somebody you're taking with you. Call somebody that you know is going to be there, a non-smoker that you can talk to. I want you to make sure and go to an area where no one is smoking every hour. Do some deep breathing, clear your head, limit what you drink. I'm not telling you not to drink, but be careful what you drink or how much you drink, and maybe try something different than you normally drink. Look at yourself in the mirror before you leave and have a nice little talk with yourself, a pep talk. I can do this. I'll get through this. It'll all be fine. So those are just some ideas. And then what you want to do is help the person work through this or rehearse it with you before they get there. So you might pretend to walk up to your client, say, hey, want to come up and have a smoke with me? And then they can practice saying, no, thank you, I don't smoke. So any kind of role playing you can do around this is a good idea. So I think you get the concept here. Okay, you really want to make sure that your each individual client knows how to use the medication that they have chosen to use to help them deal with withdrawal. So if you remember, if they're going to use Chantix or bupropion, they need to have started that a week ago. If they are using any of the nicotine replacement therapies, those start this day, whatever your quit day is. They should have started using that in the morning. So make sure that they're using it correctly. Answer any questions. If you're concerned about that, then get them to somebody else at the health center. And again, the pharmacists are great resources here. So make sure they understand how to use that correctly. Distribute that group list that I talked about last week. So if you're doing a group, ask each person who wants to have the group support outside of the group to sign it with either their email address or their phone number, and only give the list to those individuals in the group who want to be part of that. Okay, and then always end on an upbeat note, congratulate the group, and end the session. So that's what you're going to be doing in week 3. Spend the rest of this talking about what we're going to do in week 4. So let me just stop a moment here. Are there any questions about that, of anything we just talked about? Okay, so the biggest issue, the biggest trigger, the biggest problem that almost every smoker I've ever worked with over all these years that either prevents them from quitting or causes relapse is stress management. So I put the 4th session with everybody to work on this issue. The idea here is that most individuals who smoke use cigarettes in some way, shape, or form to some degree or another to deal with stress. And so in reality, they really, in many respects, don't know how to deal with the stress in their life because they've been not ignoring it, but they've been using the cigarette and they've been giving the cigarette credit for helping them do all of this without realizing that they are the ones that have been doing it all along. So you really have to teach this. You really then have to help them find other healthy ways to deal with stress. So we talked about this when we did the original training, but I want to focus on this for the next few minutes here. So you're going to again begin the session by talking about how the last week went. If somebody has slipped or relapsed, I have given you handouts to use with them. You can look at those and deal with that. But I want to really spend most of the time here talking about this stress issue. So you want to focus on 5 very specific strategies as stress management. Exercise, visualizations, separating the cigarette from the situation, look at the belief that there's some ingredient in a cigarette that calms or relaxes, and then help them understand they need to incorporate some kind of downtime in their day, every day, in order to deal with stress. So let's go over all of those. But before we do that, let me review the idea here and the theory here. So smoking, very clearly, the research, the data is very clear. Smoking does not get rid of stress. It causes stress. The ingredients in cigarettes are a stimulant. The chemicals in a cigarette stimulate. They do not calm you down or relax you. There is nothing like Xanax or Valium or any of those kind of medications in a cigarette that calms you down. However, I do not deny that many people feel more calm and relaxed when they smoke. So something must be going on, right? So the reality is 3 things, and this is what you really want to focus on. Every time a smoker takes a puff on a cigarette, they are doing deep breathing. This is exactly the same kind of deep breathing that they teach people who are in yoga classes, meditation, karate, and natural childbirth. And they teach that because it works. It does calm you down and relax you. So the person is deep breathing all day long. That is what is helping them calm and relax. Now, the smoker thinks they have to have a cigarette in their mouth to do that. So our education here is to say, no, you don't. There are millions and millions of people who deep breathe without, they don't have cigarettes, they're not smokers. So it can be done. You just have to teach yourself that. Number 2, when you smoke, when you get stressed, you tend to focus on whatever it is that is bothering you, right? So you fuss about it, that's my word. You fuss about it and you go over in your head over and over and over and over again, whatever it is. So what does smoking do? Well, it distracts you, because now instead of thinking about whatever it is that is bothering you or stressing you out, you're now focusing on what? Having the cigarette. So you're taking it out of the pack, opening it, doing whatever else you do, smoking it, blah, blah, blah. So that's allowing you to shift focus. Shifting focus is what calms you down and relaxes you. And again, the smoker thinks the only thing they can do to shift the focus away from whatever's bothering them is the smoke. So we have to teach them, again, that that's not correct. There are a million other things you can do. And then number 3, where does stress come from? It is your internal response to external events, right? So think about this. One of you may go to a dentist and have a procedure done, and I'm going to the same dentist does exactly the same procedure done. You walk in there, you say, doc, I'm fine, just give me the Novocaine, do what you have to do, and you're out of there. Bing, bang, boom. I, on the other hand, what do? I am shaking like a leaf. I'm standing in the doorway, sweat's perspiring off of me, and I'm a mess. So what's the difference between you and I? Well, the difference is that what you're telling yourself is, okay, no big deal. I can do this. What am I saying to myself? This is killing me. I'm going to fall apart, etc. So the stress is coming from the messages that I am giving myself, not from the situation itself. Okay, get that? So we have to teach our clients that the stress that they are experiencing is coming from here, not out here, and that what they tell themselves helps them get through it. So again, it's a learning process. We have to really work with our patients to help them understand that. Number 3, what does stress feel like? Well, it's irritability, anxiousness, restlessness, impatience. What does withdrawal feel like? Irritability, anxiousness, restlessness, impatience. So if you remember back to our initial talk a couple of weeks ago, all day long, what's happening with the smoker physically? So they smoke a cigarette and their nicotine level goes way, way up. All that dopamine is shot into their brain and they feel good. And then a few minutes later, as soon as they stop smoking that cigarette, those levels begin to drop and drop and drop and drop and drop until most people, like half an hour later, they're in withdrawal. So they smoke another cigarette. So all day long, they're doing this up and down, up and down, up and down, while they're living their regular life. And they're bound to get in stressful situations when they're also in withdrawal. So they have a cigarette, they feel better because they got rid of withdrawal, but because withdrawal and stress feel the same, they mix up getting rid of withdrawal with getting rid of stress. So this is very, very, very important. Again, they mix up getting rid of withdrawal with getting rid of stress because both withdrawal and stress feel the same. So those 3 things are what's happening when somebody feels more relaxed when they smoke. They're deep breathing, they're shifting focus away from whatever's bothering them, and they are adding more nicotine into their body so that physically they feel better. This has nothing to do with any miracle drug in a cigarette that calms you down or relaxes you. So if the cigarette cannot do that, let's just accept that premise, cigarettes cannot calm or relax you. How have these people been doing it all this time? Well, they've been doing it themselves. And that's the power that you want them to take back. You want them to understand that this is on them in a good way. They've been doing this because cigarettes can't do it. So you want them to own that. And then again, it's a tricky situation here because even though they're doing it, they don't realize how they've been doing it or what they've been doing. So we do have to really teach them other ways to deal with stress. If you as a health center have a stress management group, or you do any kind of formal stress management training, I would recommend that after the person is done with your quitting program, that they then enroll in that as a way to keep the process going. So what are some good stress management strategies? Well, exercise is wonderful. I realize that many people that you're going to be working with cannot exercise, so just get out and walk. If you can walk half an hour a day, every day, I bet that 99% of the people you work with don't even do that. So if they could just do that, get outside, clear their head, be on their own, whatever, that'll help. Visualizations. So again, this is that cognitive technique we talked about before, about seeing in your mind's eye a successful outcome. So have them visualize a specific situation and learn how to deal with that without a cigarette. This third one is very important. Ask each person, how would a cigarette or how would smoking make XYZ situation better? And if you ask that question that way, they're not going to be able to answer you because it doesn't. So you want to really remind every person that there is a solution to every single problem, every single situation that does not involve smoking. Focus on this idea and ask people, okay, you tell me you think smoking is getting rid of all your stress. What ingredient in cigarette is doing that? Do you think there's a anti-anxiety medication in cigarettes? Do you think there's Valium in them? So if you ask them, again, we talked about this, you want to really, to break somebody's belief, you really want to have the words come out of their mouth. So asking the question is very, very powerful. And then finally, help them understand that they need time to themselves every week, every day, if they can. So maybe you can provide them with some kind of relaxation tape, meditation tape. You may want to do meditation training as part of this program. Any of that stuff is fine. You know, any of that stuff is great. So whatever you can put into your program in that respect is fine. Okay. And then after you do that, then we want to look. Whoop, sorry about that one. Too far back. Okay, come on. All right, we also want to talk about in this fourth session a little bit here, if somebody had a slip or relapse, what you're going to do about it. So it's possible that the individual in this first week will have slipped, had one or two cigarettes. So if that occurs, I've given you a handout to deal with that, and you want to work with them about what specifically happened, and then help them learn another way to deal with that without smoking. If somebody has already gone back to smoking or full time, then you really want to unpackage what again happened and what they did or didn't do to cope with that. And you really want to focus all of this in both of these individuals or people who this has happened with on the fact that quitting is a learning process. Remind people this, nobody was born a smoker. Every smoker had to teach him or herself how to do it. So quitting in many respects is just learning another new behavior, and that is not smoking. So if you think about it, when we learn stuff, we don't just pick it up, bing, bang, boom, and we're done. Many times we have to learn what doesn't work as well as what does work, and we have to fall down a couple times. I always like to use the analogy of learning how to ride a bicycle. I would assume almost everybody knows how to ride a bicycle, but I would also guess that almost none of us got on that bicycle the first time and just whizzed down the street. We fell off, skinned our knee, whatever, but we got back on, figured out what we did right and what we did wrong, and then went from there. So again, look at it this way. Slipping and relapsing are not failures. They are not reasons to say that you cannot do this. It's part of a learning process, and that's how I want you to frame it. So I've given you a specific handout to deal with people who've just had a slip, and a specific handout to deal with people who have relapsed. Okay. Also in this session, so this is session number 4. So you want to look at medication use. Is everybody using their medication properly? Are there any questions, any issues? If the person is still experiencing a lot of withdrawal symptoms, then perhaps their medication is not enough. So you might want to talk to them about how they can change that. And then you really want to refine their coping strategy. So it's interesting, most patients will come to you on quit day and say, I know I'm going to have a problem with this, this, and this. And what happens when they actually quit is that this and this end up not really being that big of a problem, and they can, you know, they're doing fine with not having cigarette after a meal, but all of a sudden they realize that something they didn't identify as a trigger is now a trigger. So you're always going to have to be refining this plan and, you know, going back and forth about what is a trigger, what isn't, what's working, what isn't working. So always allow time for that. Okay, so that is the basics of the 4th session. And then, so I'm hoping then that you will now, you know, this week, meet with your client, have their quit day, and then next week, meet with them again for the 4th session to talk about stress management. I really want you to break it down that way because it gets overwhelming if you try to give people too much information all at one time. Okay, so we're not meeting in 2 weeks, we're meeting in 3 weeks because 2 weeks is actually the Monday after Thanksgiving. So you will have some extra time. If you do need to meet with your client in the 5th week, you know, that Thanksgiving week, then just look at what the benefits of quitting session entails. You can read that and do that with your client. Otherwise, we'll talk about the last 2 sessions. So what happens in the last 2 sessions is that we go from focusing on what to do about quitting and stopping to what are the benefits of quitting. So we're looking at, instead of losing something, instead of stopping something, what are we getting? What are we gaining? What is the new beginning here? So we try to make that shift in these last 2 sessions. Okay, we have a few minutes here. Are there any questions about any of this? Does anybody want to share what they've done these last 2 weeks? I'd really like to hear from the rest of you. And if you haven't been able to do anything, that's okay, but I'd just be curious what the issues are and can I help you with that?
Thank you, Frank. Again, if you have a question for Frank, you can either use the raise hand icon, your line will be unmuted, or you can type your question and then we are going to read the question. In the meantime, Frank, I just have a quick question.
Sure.
Do you handle the progress when you are doing a group smoking cessation therapy? What I'm saying is you will have some patients who are going to have better progress than others.
Yes.
So what is the strategy when someone is, for instance, getting behind? So you that's something that you have to individualize, I guess. But how do you handle that issue?
Well, for me, what I've typically done is the people who are quit and being successful then become your ally in helping those who are struggling. So it's almost like they become co-leaders of the group and you want to turn to them to get suggestions. So that's a very important issue because in many cases, if you're doing a group, they look at you as the leader, and that makes you outside of the people that are actually quitting, that you're not one of them. So they may listen to something that one of the group says more so than what you say. So I always bring in those individuals who are successful, like at the third or fourth session, or like the fourth or fifth session where the person's been quit for 3 weeks. Then you want to ask them, okay, can you share with the group what's working for you? What have you taken away that seems to be helpful? So then then they become like role models for those people in the group that are struggling. So it is a balancing act on your part. You really do have to make sure that you are giving everybody equal time as much as possible, and equal attention, not so much time, but equal attention. And I find that people who are being successful really do want to then help those who are struggling. So it's not like you're putting some burden on them. They really want to be helpful, and they really want the whole group to succeed.
Thank you, Frank. Fida, is there any question?
Yes, we actually do have a few questions.
Okay.
So we have, first we're going to start with a question by Mary Angela. She says, have you ever encountered any ethical issues when you implement this program? If so, which ones?
Ethical issues? No, I'm not sure what are you referring to specifically?
Mary Angela, if you would like to.
Yes, she says, do you have them sign a consent, such as privacy issues? Something dealing with privacy issues.
No, we've never done that. It's just agreed upon at the beginning, when you have the first session, that everybody in the group agrees to make sure everything is private and stays in the group. I've never really, I did a research project where we did groups, but it wasn't about the groups, it was about a medication. So no, I've really never been in a situation where I've had to do that. If that is something you feel you have to do within your group, that's fine. But no, I've never encountered any problems with anything like that.
Thank you, Frank. Any other questions, Peter?
Yes, we do have more questions. Give me 1 second.
Sure.
All right, so we have another question by Boredom. Any modification if I am using it for individual counseling, as COVID is limiting me to run group for now?
Oh, yes, the obvious stuff, you're not having interactions with other group members if you're just doing it individually. But no, as I stated at the very, very beginning of this, you can follow this pattern with individuals very easily. The only thing you may encounter is, as I said a few minutes ago, the beginning today, that if you have an individual, you have more leeway about when to set the quit date, and they may need a few sessions more before they actually quit. So that's perfectly fine. That would be the only real modification, is that the number of sessions would be different based on what the individual needs are. And some people may need to stick with you for a month or two after they quit. So they may want to, there may be strategy sessions. It almost becomes like a support system after they've quit. So that would be the big thing, I would say, is just the number of sessions. But even if you're working with someone individually, when you meet with them the first time, you are emphasizing that they need to set a quit day. And by the end of your session, you need to know what day that's going to be. It's very important that psychologically that they know that this is going to end on whatever day they've decided.
You know, Frank, before we continue, this is an interesting question. Because of COVID, some health centers are offering telemedicine or
Yes.
video consultation or just telephone consultation. And even though not all the services are being accepted by Medicare,
Right.
the question is not regarding whether is something that you're gonna get reimbursed, but have you ever tried, and this is something new, you know, to go over this smoking cessation program, either I mean basically virtually?
Yes.
With a
Yes, I have. I did a big program years ago where I did the whole thing over the phone. So it works. It absolutely works. And if you have Zoom, to me, that's as good as being in the room with the person. You know, what we're doing right now would work just fine. But I did a program, this was before Zoom or any of these softwares existed. I probably worked with 500 or 600 people over the phone, and we had very good success with it. So yes, it can be done virtually, very easy.
Excellent. Thank you, Frank. Do we have any other questions today?
Not at the moment. We don't have any additional. Oh, actually, yes. Well, it's not really a question, but it's from Boredom. He said, "Thank for the response for the program. Any tips on how to motivate those who are not ready to quit because they get lost of referral?"
Okay, well, that's a whole separate training. And again, we have that, you know, someone asked about this the last time. There is that whole training on motivational interviewing that has been recorded. I think you were sent a link for that the last time. So it's an hour-long training, and I would definitely recommend that you listen to that because it will give you lots of suggestions.
Thank you, Frank. And you know, we've been having some issues with the application or software.
Okay.
So as soon as we get the issue fixed, then we are going to send that. In the meantime, we can also send it via email. So that's something that we can do after this call.
Yeah, if you could send the people on this call that link to that specific one. I did a training last year around motivational interviewing. So I think that'll answer all your questions about that.
Thank you, Frank. And we also have an interview, a recorded interview with Frank that's going to be posted on our website soon. Is on motivational interviewing. And even though this is more like diabetes related, he also provides some very good information on this strategy as well. So we'll keep you posted, and we will share also that interview soon. Thank you, Frank. Any
You're
other?
welcome.
Fide?
No additional questions, but just as a follow-up on the link, I am going to send the link for the motivational interview webinars that we hosted with Frank in the follow-up email with the slides and the recording.
Excellent. Thank you, Fide. And I see, Fide, some hand raised icons. I'm not sure if those are the
Those are for the questions.
Okay, excellent. So if there are no more questions, thank you so much for attending this activity. It's always a pleasure to hear from you. Your experience and your feedback and your questions is very useful. Please, if you have time, complete the post survey after this session. Your answers help us to improve our activities and webinars and learning collaborative sessions. So thank you so much. As Frank said, our next session is 2 weeks from today. And if you have time, please visit our website, www.nchph.org. Go to the Resource Center and the Training and Technical Activities tab, and you will find this recording as well as the previous ones and and training on other important topics and chronic conditions affecting your population, diabetes, and information on social determinants of health, smoking cessation, COVID-19, and all the current and emerging issues affecting the population that you serve. So thank you so much. Have a great Thanksgiving. And please stay safe and be careful. Thank you.
Thank you. Bye, everybody. See you on the 6th.